said we had a choice.
We are Waltham Forest, now listen to our voice. We are Waltham Forest, the people know best. We are Waltham Forest, and we choose the NHS.
No to these turnaround teams and these Price Waterhouse Cooper organisations. I want to introduce the next speaker here, and it's a representative from the NUT. His name is Jerry Kelly, and if I'm not mistaken, he's from the local Waltham Forest branch of the NUT.
Thank you. I think first of all you should give yourselves a big round of applause for this magnificent turnout on a grey Saturday afternoon and a fantastic march. Thank you. That note of appreciation. I'm Jerry Kelly, I'm the Deputy Divisional Secretary of Waltham Forest Division of the National Union of Teachers. I'd like to start by saying there are two reasons why this is happening. One reason is the ongoing privatisation and attempted destruction of the National Health Service by this government. And the second reason is the monstrous and crippling millstone of PFI that's been hung around the neck of hospitals all over the country, and not just hospitals but schools and other institutions. PFI and privatisation are nothing more than a massive con trick, a way of siphoning off public money, our money, and handing it over to the already rich friends of this government. They are not concerned with the health, education and living standards and quality of life of working class people, and this blatant disregard for the health and well-being of a local community is just another example of this. In education, we are suffering from a blind attachment to ideology that seeks to create fear and division amongst teachers, that seeks to drive down the salaries of teachers, and that views children as automata to be tested and measured throughout their lives and into young adulthood. And some young teachers could be stuck on the same part of the pay scale for the whole of their working lives if this goes through. That is why we are striking. But we're also striking to defend education against Mr Gove's agenda of deregulation and privatisation of free schools and academies.
I am a local resident who lives a few hundred yards away from Whipps Cross Hospital, and whose members of my family have been in there on many occasions. I'm also here in my capacity as the General Secretary of the Fire Brigades Union, bringing greetings from our union to health workers in Waltham Forest and anywhere in the UK who are fighting to defend our services. We need to stand together. We need to stand together as public sector workers, as local communities, and say we are not going to stand to see our public services demolished by this government. It wasn't David Cameron or Nick Clegg who built that hospital or built our fire stations. It was generations of local communities through their local taxation and national taxation. There are hospitals, there are fire stations, and you're not going to get away with demolishing them. That's the message that goes from here and from everywhere else around the UK. I want to pay tribute to the Unison branch at Whipps Cross Hospital for initiating this. We need to build alliances of workers in our public services and people who use those public services to say we're not going to see them ripped apart. And one of the things that we're seeing throughout health, education and in my own service is that they say we can't afford decent pay, pensions or whatever else it is. And part of these cuts is about downgrading the conditions of health workers. Well, I say we've got nothing to apologise who work in public services. If you want decent public services, then part of that is having decent pay and conditions for those who deliver those public services. And we shouldn't apologise about that at all. And let's not fall for this trick about standards. Isn't it amazing when suddenly you hear Tories going on about standards in the NHS? They don't give a toss about the NHS, and we shouldn't listen to them or the Daily Mail when they suddenly start raising the issue of standards. It's a cover to allow them to privatise. Don't fall for that trick. That's what it's about. Destroying the health service. We stand to defend it. We need to remember that behind the crisis in this healthcare trust lies PFI and the people who are profiting out of the NHS in East London, throughout London and throughout the UK. And there's a simple step we can take, any government could take. Cancel all PFI debts, wipe them out straight away, wipe out the debts of each NHS trust. Then you start to solve the problem that they are creating as a way of undermining our public services. And let's remember where all this crisis started. Did it start in Whips Cross Hospital in 2008? Was it cleaners in Whips Cross Hospital who were playing on their computers, gambling billions of pounds every single day, while they then rushed off to serve somebody their dinner? No, it was spivs in the City of London and around Wall Street and around the world. They caused this crisis and they should be made to pay for this crisis. And we're not going to suffer seeing our living standards destroyed, our public services destroyed, and the future of our young people destroyed at the altar of the profits of international banks and big business, because that's what austerity is about making us and our people pay for their crisis, and we say that is just not on. And isn't it grotesque that in one of the wealthiest countries in the world they tell us you can't afford healthcare, you can't afford schools, and in one of the major capital cities of the world they plan to close 10 fire stations. What a grotesque policy, what a grotesque mayor we have who is forcing that through in London in Boris Johnson. And as I said, we make no apologies for demanding decent pay and conditions. If you want firefighters to be sent into burning buildings, they have to be fit enough. And the evidence shows that if you expect large numbers of people at 60 to be doing that, you're living in cloud cuckoo land. And that's what the attack on our pensions is about. And reluctantly, therefore, this coming Wednesday, firefighters across England and Wales will be taking strike action to defend their pensions. And I would ask every single one of you, they walk out at 12 o'clock. It's not a pleasant thing to walk out in a service like that. And I would ask you to get down to your local fire stations and tell them actually they're not isolated, they don't stand alone. You stand with them, give them your support. They're there for you every single day. Please be there for them on this day. Well, if our grandfathers and grandmothers had listened in the past, we never would have had the NHS in the first place. We never even would have won the right to be in unions. We never would have won the right to vote, for that matter, if we hadn't got off our knees and fought for it. And that's what we got to do today. Thank you very much. Solidarity.
To be a worker at Whips Cross Hospital. I'm really proud to see you all here today. I haven't worked there that long, but my kids used it for many, many years, and I used to live here. But I've been a unison steward in lots of different places in the community where I used to be an occupational therapist, but I have never known such a nasty management as we've got at Barts Health. Really, they are the management that they're cutting health provision across the whole of East London, and they want to spend all that money and pour millions into the bankers and the city and PFI. And we know what PFI stands for. It's Private Fraud Initiative. It's supposed to be Private Financial Initiative. But this hospital has got millions of debts, millions, and they built the London PFI for £1 billion, and now they have to owe about 5 times as much back. And who are they making pay? They're making us pay. They should be bailed out. The government's happy to bail out the banks, aren't they? Why can't they bail out the PFI? And patient care is at the centre of everything we believe in. And the Barts management they're the ones that care. They put out this silly logo with people holding hands, smiling, saying because we care. Well, actually, it's an insult to us as workers on the wards, because we're the ones that care. The nurses, the band 3s, you know, who are on a very low wage, are all going to be downgraded to band 2. You know, and they're the ones, the healthcare support workers, who do a lot of the hard work on the wards with the patients, the cleaning, the washing, the moving, the handling. And it's a disgrace that they're actually doing this. It really is. And I think the other thing they're doing is they're silencing us. They're silencing Charlotte Monroe, who was a steward and a Southside rep for over 20 years, who tirelessly campaigned to save this hospital. And my question to the management is that, no, we won't be silenced, because actually we are all Charlotte Monroes. And the pain The pace of the cuts that they're making is unprecedented. They want to rush it through. They're giving us, we've had about 40, 50 consultations. They have shop stewards running ragged. Why are we paying a private company when we're in debt? Then people have said before, like Len said originally, we've got Price Waterhouse, Donald Muir. You know, they've been brought in to turn around the hospital. £2 million they're being paid, and I've said it before, but I'll say it again because not everyone heard me when I was at a meeting, is that I think if I got Rodrigo here and a couple of people from theatres, a few band 5 nurses, I can see a band 3 over there, get together with me, pay us about 500 quid and we'll show you how to run this hospital. And the last thing I want to say is that really we have to build a campaign. We do need to take strike and industrial action. We need to spread it, and we need to say it's one fight, one struggle, united we can win.
Okay, hi. It's fun. It's really heartening to see so many people here and so many staff from Whips Cross Hospital and across Barts Health. I've been involved in campaigns before. A few years ago we were fighting to save Whips Cross Hospital, but I've never seen so many large groups of staff here adding their voice and taking their stand. Now what we're facing across Barts Health is a huge programme of destabilising staff, of destabilising our services. Hundreds of staff who've committed themselves for years, built up their skills, cared for their patients, worked over the hours, stayed far past when they should have gone home, are being put at risk, having to compete for their jobs, facing redundancies, facing down-banding. So whether you're in that situation as an individual, or whether you're in a situation where, having worked for the Trust for many years, you are suddenly faced with the realisation that the powers that be would like to get you dismissed for speaking out in your union role, and you're looking back on your life with that perspective, it hits you in the solar plexus. So what they're trying to create is an atmosphere of fear. Fear for speaking out. I'm under attack because I spoke out about reductions to the stroke service, and I know that that's a damn good service in Whips Cross. Right. Many people here today, many people at protests at the gate, many people in meetings with management are the people who are at risk, and they are speaking out. So that shows that the programme of trying to create fear to shut us up is not working and will not work. And why? Because, as Sam said, the stakes are too high. It's not just our jobs, it's not just our dignity, it's not just our worth, it's our health service. We run on this health service. The Trust are saying that their programme of down-banding is in order to make Barts Health Trust sustainable economically over the years. Okay, so what creates a sustainable health service? What creates sustainable health for our population? And that is the health workers who have a vision of what is needed, who study, who train, who work hard, who are committed, and who develop skills that cannot be measured over the years, cannot be tick-boxed. They are the people, and they are the very people that are under attack. We are saying no. We have a responsibility to our health service, to ourselves, to our colleagues, and we will not allow this destruction. We are the builders of the future. We are the builders of health. We will not allow this destruction. And the path of shutting people up and not allowing open and public debate and discussion on these vital matters is the path to disaster. We will not let Barts Health Trust take us down that route. It's our health service, it's our hospital, and we will defend it.
Thank you. Good afternoon, everyone. Thank you, ladies and gentlemen, for coming here today. It's a fantastic turnout. This is sending a strong, key message to the management structure of Barts Health that the changes that they are imposing, which are too much, too soon, is wrong. We're trying to let them know that we care about our patients. We came into the health service to ensure that we provide quality care safe care for our patients. Staff are telling me as a union steward that they feel the changes that have been recommended would lead to patients being put at risk. The public need to know about this. It is unacceptable for us to know that this situation is happening without fighting to say this is wrong. Staff who've worked hard to gain their profession, their degree, to gain the skills, have now been told that all that hard work is not going to be looked at, and actually you can be paid a lot less and we won't consider the hard qualifications that you strive to achieve to maintain your professionality. But the problem is, we also know that colleagues are competing against each other because they'll know they'll be doing the same job, but some will be getting a lot less pay for doing that because there will be no other skilled people available to do all that the Trust wants them to do. But the nub of this discussion today, I feel, is looking from history. We need to learn as the NHS. Mid-staff was an absolute tragedy and a disaster for the health service. It hit the news, everyone's aware of those failings. I feel here at Barts Health, we are not learning from that tragedy because we are taking the same steps to ensure financial security is beyond looking at our patients. Our patients come first. We are trying to say that it's unacceptable that you will slash hard-working Band 6 nurses who've worked hard to be there down to a 5, which is a newly qualified staff nurse. There is no future for our staff if you haven't got that career progression and the terms and conditions are not right. We need to maintain those standards so you get the best from us for our health service and ultimately for our patients. The Francis report gave lots of key recommendations, and they saw that staff felt pressurised by management to do things that are unacceptable. The feedback to me as a union rep is that they're being pressurised to make these cuts that the staff know are unacceptable and unsafe. You here today are making a stand, and that's why you're here, to send a key message, not just to Barts Health, but actually nationally to the United Kingdom, that it is unacceptable for a trust to put these unreasonable demands which potentially puts our patients at risk. Thank you for being here, thank you for making a stand, and we will not roll over and die. We will fight and we will succeed and get our message across. Thank you.
Because we got a big message here for Barts Health. Anton, over here. Come on, come in front, come in front. My name is Rod. I represent the nurses. Who cares? We are your nurses. We care for you. Unfortunately, it seems that the government and Barts Health don't care. They want to cut us down, they want to disband us, they want to force us to leave the hospital. They're forcing us to abandon you, the public who we care. We have been here for so many years, me myself 11 years, most of my fellow colleagues here have been here for 13, 20, 30 years, but still to their eyes they don't exist and we don't matter to them. Well, I say to you, you matter to us. We care for you. We are there for you every day, 24 hours, 7 days a week. Now we need you to be there for us to continue taking care of you. We need to be there for you. But we can't do that alone. We need your help. We are crying for your help. They're trying to cut us down. They want to shut us up. They want us to leave this hospital and move away. We don't want to do that. We are part of this community. This is our community. Whips Cross is our hospital. Whips Cross is your hospital. If you don't...
Children's future. This is not just your hospital. This is your children's hospital. If they carry on with this privatization, who will suffer? It's you, your children, your children's children, your uncle, your daddy, your mommy, your granddad, your grandnan.
Good afternoon. Thanks to all the staff, all the fellow trade unionists here, and members of the public for supporting us today.
And currently I work in the cardiology department as a nurse specialist, where my own job is under threat. In the last 2.5 decades I've been around Whips Cross, I've never seen morale so low. I've never seen the hospital at such a low point. But then I've never seen such a widespread attack on jobs, and I've never seen such a widespread attack on services. Barts Health wants to shed thousands of jobs and downgrade far more of these nurses here today. Experienced hard-working staff nurses will be downgraded to the pay of a newly qualified nurse. Specialist jobs been cut by 20%. These are highly qualified, knowledgeable professionals, and they're experts in their fields. They often do the jobs of consultants at the fraction of the cost, with all the extra skills that nurses bring to these roles. This will inevitably lead to the reduction and the loss of services. And admin staff who are at the wheels and allow clinical staff to do their own work will not be replaced and having their jobs cut too. In sheer desperation, the Trust is now paying millions of pounds to this turnaround team, who are completely disconnected from the ethos of the NHS and what we do on a day-to-day basis and how we care. This team only look at spreadsheets and numbers and ignore the human reality of the decisions they make. We've been told we were told there were no cuts to services at Whips Cross and that the hospital was safe. However, we've been live from the start of this whole process. When there was a merger, we were told there'd be no effect on jobs and services. They promised us pay protection, which we were assured in our consultations, and this has now been cut in half. It's a barefaced lie, and more lies will follow. We can't believe what Barts Health tell us anymore. All of this is to hand over millions of pounds in a monthly mortgage PFI payment on a hospital that isn't even being fully used at the moment. If the government can wipe out debts to greedy gambling bankers, they can wipe out this preposterous debt on the NHS.
Mobilisation of people, of workers down in South London around the Lewisham Hospital campaign.
Thank you very much, Len, and thank you very much to the Whips Cross campaign for inviting Lewisham to join your fantastic event today. It's very humbling to see all the hospital staff here fighting for, on the one hand, the standards of clinical care that we're proud of throughout the NHS, and on the other hand, from things like being debanded and being abused by the Barts Hospital Management Trust. I'm very sorry to hear that, but it's great to see the staff here and the unions here in support. In Lewisham, a year ago we were faced with an amazing event where we are as proud of our hospital as you are of yours, but the TSA process, the Trust Special Administrator process, was used by the Secretary of State for the first time to go into an entirely different trust, South London Healthcare Trust, which was being strangled by two enormous PFI contracts. £220 million for those contracts, and over the course of those contracts they were going to pay 11 times that money back to the private finance firms. That is just a disgrace, it's a fraud, it's wrong, and we can't accept it. But in that TSA process, the brilliant idea of Matthew Kershaw and the Secretary of State was that they would close Lewisham Hospital, a completely different hospital. You can't close the PFI hospital because you have to keep on paying the finance companies for the rest of that 30 or 60 year contract. So they were going to close one of the best hospitals in England to save the PFI hospitals. We've taken Secretary of State and the TSA to court, and we won on the 31st of July. The Secretary of State is the one that's acting unlawfully and illegally. The fight is not over. We have not actually won yet. We've celebrated our battle, but the government has the temerity to come back and appeal against that, and they're going back to court on the 28th and the 29th of October. I think we'll win again because we're right. The staff are right about the fantastic nature of our hospital. The community are right to be afraid to lose such a good hospital, and the government's lies and inability to justify their decision was clear in court. But I know that when we win on the 28th of October, they will come back again to the Supreme Court. And if they lose in the Supreme Court, they'll just change the law. Now, one of the things about the Trust Special Administrator process, which I think you need to know about, is that they were testing it for the first time. They thought they could ride roughshod over the people of Lewisham, and they were wrong. But they've learned from some of those mistakes that they made, their crudeness. They've gone on to Stafford and they're trying it now. I've said on BBC television, Stafford is not a bad hospital. It's the underfunding of nursing that's the wickedness there, and the management response to trying to become a foundation trust has undermined standards there. So we must defend Lewisham Hospital as we defend Whipps Cross. One of the things we've learnt in Lewisham is that we are not an isolated hospital with a great campaign. We will carry on being under threat until all the campaigns around the country link up to defend the NHS, which, as we've heard many a times, is the greatest democratic achievement of the Labour movement in this country ever. And it is under attack now like never before. The methods used by Barts Hospital, Barts Trust, are very similar to the TSA methods. The TSA set up consultation events which were bogus. I'm a doctor. I hope some more doctors are supporting Whipps Cross, and if they're not, they should do, and you must get them on your side. We are standing alongside nurses and porters and everybody else to say we are the ones that are fighting for good standards, not the TSA. But the consultation process, they had a predetermined decision in their mind already. They were already, and we know this from papers before it was even announced that they were going to set up a TSA, that they were going to close Lewisham Hospital in order to take out a whole section of the health economy. The reason Lewisham community stood up to fight was fear of their children with sickle cell disease going to an urgent care centre and nobody knowing how to relieve their pain. Fear of women in pregnancy and bleeding and going to a maternity unit with no emergency care and having to be put back into an ambulance in the middle of labour. Fear of the elderly community who are dependent on a local hospital and to be part of the local community, and yet they were going to close every last acute bed in Lewisham Hospital. They were going to close the maternity unit, they were going to close the A&E. So the community stood up with the campaign and with the hospital staff. The one thing I would say to you, and it's been said by one of the previous speakers, you've got a wonderful union support and a wonderful staff support from the hospital. Get out there and win over the community and get them involved in your campaign, because that has been the fantastic strength of the Lewisham campaign. And if you do that, you are undefeatable. Huge solidarity to Whipps Cross, and thank you again for inviting us.
But the first thing I want to say is what's happening in Whipps Cross in terms of the resistance is actually, we have not seen the kind of resistance among health workers that you guys have shown us in decades, actually. So Barts Health are running scared. I was very privileged to go along to a meeting at Whipps Cross where doctors, nurses and therapists voted that no confidence in Barts Health and voted to consult on an industrial ballot. This is very serious. This is the first group of health workers I know of in this last few years that have said we are going to stand up. And what is clear from the meetings, it wasn't about your jobs and your pay, but it was patient safety that you were saying. And the point is, you will get support. Now, the other thing is I want to say is that there's a really nasty game going on, by politicians, actually, that they are actually trying to blame immigrants for the problems we got in the NHS. And they're actually currently working on a law to go through Parliament that will stop people getting free healthcare until they've been in this country for 5 years. Yeah? Now, this is a threat to all of us. If this goes through, that's not just a threat to individual health, it's a threat to public health, and it will increase inequalities. But what it's really designed to do is actually to divide us one from another, to divide black and white, Asian and non-Asian. But we will not be divided, and I want to say as well, to be quite honest, if you want to get on side, we have to learn from Lewisham. You don't start with the BBC, you start with the community. Yesterday I spoke in Queen's Road Mosque to 1,600 people. I've got some of the letters, the petitions they've signed. If you go to the community, to the churches, to the unions, you will get support.